because now we want to turn to sort of our local community of practice and how do we continue together. And so in addition to all of the efforts that have been going on in terms of getting curricula together for IPE, working together through the IPE Center, there's also been this push, rightfully so, of, okay, if you build it, then people will come, and the faculty need to know what to do, right? And so what's been wonderful is that the IPE community here has partnered with the Center for Research on Learning and Teaching to develop these leadership fellows. So I want to ask our panelists to come up. So Paul Walker, Stephanie Munz, Amber Dalwig, and Gina Shereda. And we're going to lead with Gina. Oh, Paul. And so Gina's going to give us a brief introduction about the program, and then we will get the opportunity to hear from each of the faculty members, their work independently and as well as together.
Well, thanks, Caren. Hi, everyone. I am Gina Shereda from the Center for Research on Learning and Teaching. And my role on the panel today is to talk a bit about, just give a framework for what the Interprofessional Leadership Fellows program is and how it's structured. So I thought I'd start with just a couple of minutes on that. So I also want to acknowledge that this has all been possible because of very generous support from the Center for Interprofessional Education. And I've also had a tremendous amount of support and help with, from two colleagues of mine at CRLT, Taz Daniels, which I know is somewhere in the back, and also Meg Bakewell, which I know is with us today too. So thanks to you both. So the Fellows program really grew out of one of three branches of the interprofessional education work here on campus, and that's the faculty development branch. So this was really a program that was designed to develop change agents for interprofessional work here on campus. And really help faculty and collaborative practice workers to hone interprofessional and leadership skills. So the program centers around an 18-month fellowship, and we also have additional information at our CRLT table in the back. It's an 18-month fellowship, and it's centered around having teams of fellows complete an interprofessional project, so an interprofessional team project. And these are groups of interprofessional teams themselves as well. So you probably interacted with some of the first cohort of fellows coming in here today. They all had posters in the hallway outside. So if you haven't had a chance to talk with them, I'd encourage you to do so at some point today. So fellows attend a 3.5-day training that's sponsored through, it comes out of a grant from the Josiah Macy Jr. Foundation. And those training sites are, they were developed from experts at the University of Virginia, the University of Missouri, and also the University of Washington. So there are 3 sites across the country that do this training. And the purpose of those training is really to prepare health professions faculty and collaborative practice clinicians to really lead IPE efforts at their home institutions. So teams of interprofessional workers or faculty go to these sites from all across the country to really get coaching and support for their projects. So we decided to make this kind of an anchor for the Fellows program, but we also wanted to have a support network here on campus. So the 3.5-day training put on by the Josiah Macy Foundation is excellent, and they provide skills, content strategies for really bringing these projects home and making them successful on the home campuses. And it's really an opportunity to network more broadly with others doing interprofessional education work across the country. So this training is really excellent, but we also wanted to provide support and scaffolding for that here at U of M. And that's kind of where we stepped in at CRLT to provide a learning community for fellows here on campus. And we basically have once a month meetings with our cohort of fellows in January through May. We do readings that are foundational to interprofessional education work and bring in resources across campus. So that's from Taubman Health Sciences Library, the Office for Academic Innovation, other groups that fellows might want to support from as they're developing and carrying out their projects. And we also prepare them then for going to these train the trainer sessions across the country later in the year. So by the time our fellows go to those trainings, they have a good idea of their team project and then receive further support from the site once they go to the train the trainer. We've also worked to develop a seed funding program as well, so each of our teams can apply for up to $5,000 to move their projects forward, and also just provide as needed consultations, resources as they work to develop their projects. So we were just delighted to welcome our first cohort last year, and we also have recently welcomed our second cohort, so we have representatives on the panel from both cohorts. So I just want to encourage you to talk with them more about their projects, and I know you'll hear a bit more from a couple of them further down the panel. So that's my intro.
Panelists to introduce themselves and introduce their work, and just start with who are you, where are you in your IPE journey, and what kind of work do you do, and then we'll do that for each person, and then we'll go through and talk about the projects that they're working on, and then finally it'll be a group effort talking about how as a community can we all move forward together to not only get more fellows trained, but to help learn from our fellows as well. So that's kind of where we're headed. So Amber, if you would start us off, that'd be great. Thanks.
Good morning. I'm Amber Dalwig, and I'm with the School of Nursing. I had the pleasure of being in the first group of fellows, and I have to say the project that I was a part of, first of all, I didn't know the team at all. Zero. I knew them in no way, shape, or form. But what I did find out right away was that they wanted to do something different. And I think as a project, we're working out in the community. I have to say thank you so much. You've said such a important beginning, middle, and end. So I've worked with Dr. House and Dr. Ferris. Taz has been wonderful. We even had a little mix-up in the beginning. There was one person we were working with, and they left, and a new person came in, and it's just been a wonderful experience. And we're going to be working together all summer, and we're going to be writing. So it's been wonderful.
Can you say more about what your project is focused on?
Our project is the attitudes that interprofessional students have with learning together. We are out in the community doing nutritional assessments through Ypsilanti Meals on Wheels. And we have nursing students, med students, kinesiology students, pharmacy students, and gosh, I feel like I'm forgetting one. But they go out together with their same profession and do assessments in the home. And then halfway through they switch and they go with a different profession. And what we've learned so far, because it's just the end of the semester, is they've really learned that different questions are asked by different professions. And I think that's good.
Yeah, it's great. No, absolutely. What brought you to the fellowship in terms of being interested, and when you were engaged in the fellowship training, what kind of things did you learn and experience?
Well, I really started doing the IPE with Anika early in when they had the service learning course, and I always felt that my nursing students needed to know who they were going to be working with. Where did they come from? Why did they choose it? You know, what kind of things are they learning? You know, what do they see as important? So I always kept trying to get students to come. It was a little hard because it was out in the community, and usually I was in Jackson or Monroe. So being selected and able to work with different professions has just been like an awakening. The beginning of a dream, you know, the dream actually coming true. You know, so everything happens at exactly the time it's supposed to happen. Even if it seems like it takes forever.
Yeah, no, and it strikes me too that our IPE initiative is sort of this meta, like, diversity, equity, and inclusion experiment, right? Because we're all in different cultures and different environments. We are trying to do the same thing to take care of patients, but we speak sort of different languages or don't really understand the vocabulary. And so being able to work together, especially around the care of individuals and their health and wellness, I think is one of the richness, of the program. Stephanie, can you tell us a little bit about your work first and how you got to the fellowship?
Good morning, everyone. I'm Stephanie Munz. I'm a School of Dentistry faculty member, but the bigger hat that I wear is I'm over in the health system as a hospital dentist. And inherently in my everyday work, I certainly can't accomplish very much without the expertise and the input and the collaboration of other health professionals. So I value this in a very intense way. And so when I was presented with the opportunity to be part of the fellowship program, I was very excited, and I think I inherently also have a problem with always saying yes to opportunities, but this was an obvious yes that I wouldn't deny. So that's kind of how that started for me, but I think the reality is I know that dentistry is one profession that is often kind of comfortable in our own silo, and it's time to really consider what kind of evolution we could have by being together and what that could mean for other professions and what we can bring, but also what we can learn from them as well. So our project, I'm working with a wonderful group of people that I'm certainly one of the most junior, and I don't mean youngest necessarily, but I've been leeching off of them and their mentorship as well. And so the networking opportunities for me have been very valuable. But our project is focused on a simulation scenario in the team-based decision-making course, and we've had a wonderful opportunity to combine and collaborate with the course directors and the instructors in that course, and they've allowed us to kind of infiltrate one of their modules, and it's the nursing module. And we are focused on a patient who's in an acute care setting, and they're in an acute ill situation where the patient is critically ill and may pass away. And we're asking the students to test their skills of teamwork. We really don't have a focus so much on if they make the right clinical decisions, but more about how they come to a decision together. And talking about advanced care planning. So two very important topics that maybe together we can come up with better solutions and those that align with patient values and goals as well as the healthcare team's values and goals. So that's our project. A lot more value and richness than I could have ever expected, and it's just getting started. We've completed our first semester last week, and it's going to be interesting to see where the other opportunities go from here.
And last but not least, of course, is Paul Walker from the College of Pharmacy. You could tell us all of the things that you do and how you got to the fellowship.
Well, good morning, everyone. As Caren has said, my name is Paul Walker, and I'm faculty at the College of Pharmacy. I'm also Director of Experiential Education for our college, and that's sort of how I've gotten engaged in the IPE activities. Just as my colleagues have accreditation requirements that IPE be integrated throughout the curriculum, I'm challenged with the same the task. And being involved with experiential education, I've got to figure out how do we meaningfully incorporate interprofessional education into our pharmacy practice experiences. And so that's sort of how I came to the fellowship. I wanted to improve my skills in making these kinds of things happen, as well as to expand my network of individuals who are involved in IPE work so that we can come up with some creative ways to bring some things about. I'm currently working with Stephanie and some other colleagues in the School of Dentistry and at the health system to implement an IPE interaction between our fourth-year pharmacy students and some dental residents and dental students at the health system. We hope to get that in place in the next month. We'll see how that goes. We've had some challenges in making that happen, but I think we're moving along. And so that's some work that we're currently doing that's actually not related to the fellowship. I've got a great team in the IPE Fellowship Program. We have not decided on our project yet. We have been challenged by the very same thing I think that all of our units are challenged with, and that's finding the time to make IPE actually happen. And so we're actually meeting tomorrow to go through our list of about 10 project ideas to identify which one or two we want to focus on. Gina tells me we need to get that done by the time we have our meeting in April, which is about a week and a half away. So we've got some work to do tomorrow, but we've got a number of ideas that we are evaluating, from developing sort of a capstone simulation event for a number of different disciplines, to looking at how do we effectively assess IPE competencies in our practice experiences, to how do we look at outcomes for patients or communities where IPE activities are going on. So we've got a number of things that we're looking at, and hopefully by end of day tomorrow, we will have focused on one or two as our priorities.
Yeah. Yeah. Well, and you bring up a bunch of great points, which is that there's lots of activity on campus. There are a lot of places where we're providing care where multiple individuals from a variety of schools are working together. And it's, while we're siloed technically, right, in our disciplines or in our training, we aren't siloed in our care delivery. And so I think one of the really exciting things is that people are kind of changing their lens a little and thinking about where are we delivering care and with whom are we giving delivery of that care, and how do we partner together? How do we work together to sort of surround the patient? And this image is really what we're trying to capture with the IPE notion, is that the patient, the family, the individuals, the people are in the middle of this group of providers who can all lend their expertise to the health and wellness of the folks at the center of the image. So to that end, right, we get very focused sort of in the practicalities of, we've got a project, we've got deadlines, but what do you see coming next after your fellowship technically concludes? How do we maintain this momentum?
Well, that's very easy for me to answer, because we are already continuing, and I think part of it is the center itself. The center is helping us to, stimulate and to grow and to continue to change what we're doing and how we're doing it. So we're already talking about our next project. I'm already talking about taking the pilot project that we've done and expanding it now into not only finding out about the students, but what about the clients who are older, who want to live in their own homes. And I don't know any of you who want to go to a nursing home. So this is important. We need to find out, is it better to talk to a pharmacy student or a nursing student or even a dental student, a kinesiology student? Where do they get the best of what they need? And so we're also working on part of the grant in attaching, now this is fabulous. You're going to like this. The community of Michigan medicine getting involved, which means we can not only have the academic, the hospital system, but over here we can have the community where we're all working for the same goal. So it's exciting. because the Affordable Care Act, the ACO, has moved into accountable communities. We have to be available for our community, and that's why I love that picture. That's where the nursing students that I teach, I take them out into the community, and they're like, wow. I understand a little bit more why they cannot take care of themselves or why they need this or that. So there's multiple projects with the same people.
Sure. No, absolutely.
And with other people.
Yeah.
You know, one of the people I work with, Dr. Smith, is from Flint. And so there's opportunities going between the schools.
Mm-hmm.
So it's infinite.
And the hope is that the fellows will serve as ambassadors for the faculty as well in their leadership to sort of hone their skills, get the beta tests going, and then sort of spread their experience as well as their expertise with all of us as well. Stephanie, can you say more, do you think, about, you're hospital-based, right? And so that presents unique opportunities and challenges around systems and getting learners together at the same time or at the same place. What sort of challenges have you noticed in that regard?
Sure, and I think being in a hospital system, the pace can be the determinant of how successful you are in projects, and especially in educational projects. And Paul's example of our effort, which at this point is about a year in the making, centers around some of the challenges center around logistics of when our students and our learners can actually interact and how they can interact, who has pagers, who doesn't have pagers, who has access to the hospital system computers, and silly little barriers that you wouldn't really think create that impact that they do. But I think that's the opportunity to be creative and work around those things and to understand the other professions' challenges as well.
Yeah, and I think that's where the disruptive innovation comes in as well, right? Because we just know what we know, we do what we do. And then when you are, I don't want to say forced, but when you are sort of confronted with we all need to work together, but my screen looks different than your screen, and can you have access to this information, or can I? That's where we, again, find the barriers and the opportunities. Paul, earlier you were talking to me a little bit about the challenges about engaging faculty as well. Could you speak more to that? You're going to have to turn that mic on too, my friend.
Yes, you should. I can't read that. Thank you for that assistance. It's kind of difficult to read these little words. One of the challenges that I think that I face in my role is the sustainability piece. What I want to do is to create meaningful experiences that we can sustain. I don't think one-offs are going to get us where we need to go. And so what I'm looking to do is to create learning experiences for our students with other health profession students that we can sustain for the long term. One of the challenges, however, is that many of the mentors and teachers in our clinical practice setting are not regular faculty. They have real day-to-day jobs in practice, and that can be demanding and so forth. And I don't know to what extent they understand what IPE is from the cookbook definition that we're operating from. So how do we get them all on board? How do we get them educated and trained with IPE? And that gets back to my concerns about how are we assessing IPE. I think our preceptors need to understand what it is, what the competencies are, and practice those themselves, and then also be able to evaluate those with our students. And so I think that's one of the real challenges in making IPE sustainable and making the change in the practice setting that needs to happen in order for us to really achieve the outcomes that we think we are moving towards.
Yeah, no, and you mentioned a pretty important thing, and I'm going to ask Gina's opinion about this as the other resident edu-geek on the dais here, but this is a Health Professions Education Day, and we've had 80 submissions, which is just incredible, of the scholarly work that our community is doing and working together to really assess teaching and learning and evaluating how our learners learn, as well as the benefits that that has for our patients. So as we move forward together as a community, I also want to make sure that we're thinking about this in a scholarly manner, because particularly for faculty who are doing all of this educational work, which if brought together in a scholarly way can actually, get us the coin of the realm, as it were, for things like advancement, promotion and tenure, recognition, distribution of information, and we can continue, this is my little rah-rah, right, to be the leaders in this endeavor. So Gina, could you talk more a little bit about how CRLT and some of the other units are thinking about research in education around these IPE efforts?
Yeah, so I have a couple of thoughts on that, and one kind of goes back to what we were talking about with barriers and momentum, and one piece of this that I think is important is this intentionally built-in mentorship of previous cohorts of fellows to incoming cohorts. So we've really built that in so that, one of the last learning community dinners that we had last year, we really asked the first cohort, since this was the first time that we've done this program, really what worked well for you, what would have been more beneficial to come earlier, what information, could we have rearranged so that it's more useful to you. So we've really been, it's been really excellent to hear the feedback from the first cohort to feed that into the second year of the program and to really expand that network. And one piece of that is that we've, like I mentioned before, that we've brought in a lot of resources for the fellows in terms of, the Office for Academic Innovation, the Taubman Health Sciences Library, to this piece on scholarship. One thing that has come out of the fellowship was a collaboration with Taubman. An informationist at Taubman named Emily Janier developed a really fantastic resource for fellows on publication venues and impact factors for journals related to interprofessional education. So that's been just a tremendous resource, and we presented that a bit earlier for our second cohort so that we could kind of kick things off by thinking about really what is your research question and where might you think about presenting your work or publishing. And the other way that that's kind of built in is that we have the seed funding available for fellows, and one of the expectations of applying for that, it's a really low barrier to apply for funding. We don't want anything to stand in the way of getting that funding, but we really want to know what is the question being answered by this project, and with these funds then what is your plan for scholarship. So it's a flexible definition in terms of presenting somewhere or writing up a paper, so we have various ways of getting at that, but we really are trying to start things off by thinking about how are you disseminating your research and work.
Yeah, and that's one of our challenges here is we're so big that sometimes we're so big, right? And what's nice is that a lot of the open educational resources that we have on campus, particularly Deep Blue, is going to help us keep track of all of the work that you guys are doing and presenting here at HPE Day. So again, a little plug, if you haven't already, we're going to recontact you again and ask you if you would to put your poster into Deep Blue so that other researchers or other individuals here on campus or elsewhere can actually connect with you and connect in your information. And so to make sure that we maintain the connections, I want to open questions to the floor to sort of have folks, say, hey, where can I sign up, or what other things can I do, or if there are any other fellows in the room who want to share their experiences or their challenges, I would invite you to do so as well.
Yeah, I can see you cringing since I was the one responsible for all of you getting up there. But you mentioned this, but I think one of the observations that I have made looking at the cohorts that have come in, and Amber really touched on this a little bit, is a sense of community that you get. What I've noticed is in the past was that there were people who were doing a lot of things, but they felt isolated. And as I look at their backgrounds as they've come in and looking at the interaction, it's the fact that at last I got somebody I can talk to about my goals. And you touched on it, Amber, but I just wanted people to perhaps expand a little bit on that, a little bit. So.
Thanks, Frank, for the question. I think there's tremendous networking opportunities through the fellowship program. One of the ways that I think our groups came together, we had an initial brainstorming session at the very first fellows dinner, where everyone in the room got to put their ideas up on whiteboards or huge Post-it note sheets. And then you had an opportunity to go around the room, read what people had offered, and indicate which things that you were interested in. And so it helped to pull together a group of people that were interested in doing the same kinds of work. And so I think it does promote developing a good network with some colleagues who share your interests. So I think it's very effective in doing that.
I think for me, if I look around the room, I realize that I wouldn't have known any of my co-fellows without this program, and a lot of the similarities that we hold and the goals that we have for our students and for collaborative care align very well. And so I don't know how else I would have navigated that. And it also provided some structure. The fellowship itself provided structure and time that it was on my calendar. I had devoted time to that. I made a commitment, and I think there's a lot to be said for creating that space to be able to do that and have those opportunities.
I think the Macy training where we came together at different, I was at UVA, and really it wasn't that we learned so much, is that we've got to learn about each other and how we might work together to learn together. I don't know if that makes sense, but so I think that was really important. That really kind of was the diving board, kind of thing. Networking is so important that, now there's connections between community, between medicine, between schools, public health. And I would have never thought of working with kinesiology, okay? It would not have come into my mind. But yet that is so very important when you think of older adults and you think of exercise and you think of, just because PT and OT are primarily in the Flint, you still can see how that school can work immensely well. So I definitely see how the networking in the community is wonderful. I'm all community, so it's easy for me.
Yeah, and I think the other thing that's nice is, when we talk about IPE, there are many of our specialties who sort of say, yeah, we've been doing that forever, not sure, so physical medicine and rehabilitation is like, yep, we know about this. We know about multiple teams with a variety of experts in the room, all focused on one person. Or, our public health and social work colleagues who absolutely focus on team care and don't live necessarily at the top of that pyramid that you were talking about. So I want to give anybody else in the room the opportunity to ask questions or comments. Thank you. I'm not intimidated that all the deans have gotten up. Let's just say that.
I'm just a faculty member in internal medicine, so don't be intimidated.
And DLHS.
And LHS. So part of sustainability is allowing junior faculty members to pursue their academic careers. Academic advancement occurs within schools. You've talked about the importance of networking, but that is not necessarily something that is universally understood at the provost's office nor at the executive committees. So from your experiences, what would you recommend to the school's executive committees as well as to Central Campus to allow this to be sustained?
I definitely have an answer for that. invite us to your retreats. Let us share. And probably the most important, let us bring a client. Let them speak for what they've gotten. It's just like bring us to you, and we'll share the information with you, and you can then, in your own mind, see what the value or how much value can be added. I love retreats.
Said no one ever. But the other thing I think about is also to speak language that's familiar. So in a way, this is team science, right? This is about team education, team science, interdisciplinary, cross-school momentum. And I think that speaks well, especially when we go across the different University of Michigan sites around the state of Michigan. And that's sort of a nice segue to our next questioner.
Yes,
If you would introduce yourself.
I'm Donna Fry. I'm the Dean of the School of Health Professions and Studies on the Flint campus. And my question for you is I'm trying to figure out what resources we need to have on our campus that would help us connect better. And certainly we have and are willing to have our students drive down here to meet up with students on this campus. But quite honestly, it took me 45 minutes to find a parking spot, so I missed part of the talk this morning. It's not always feasible, and it takes a lot of time to schedule that. And so I'm also looking at technical ways that we may be able to connect, and I would like your input on that.
That was one of the, first of all, I think you have a wonderful IPE between your physical therapy and nursing. It's fabulous. I would like to transplant it. But what we really came up with was, how do you give them credit? If you give a student credit for doing something that they want to do, they will do it. So that was hard to figure out. How does the credits allow them to transfer between schools? That's one of our barriers. So we're working on that, but it takes time. So I think that's one way.
And I was going to offer, and you mentioned it, but to look at some technological solutions. What kind of small group work can be done in an interprofessional way across campuses? Can some of the interprofessional coursework that's offered here be brought to the Flint campus using technology? So I think we need to leverage the technological solutions with some of the activities that we have going on right now.
Yeah, no, and I think there are some other, me, I'm the big blow it up idea, right? There's actually a bus from Ann Arbor that goes to the Detroit Center a couple of times a day because the main campus has interactions with the Detroit campus. It might be interesting to, think about transportation to and from our Flint campus. Again, the technology, blue jeans, if we're talking about e-health, then that's even a more unique way, which is to say, well, we'll both learn at distance. So I like to think kind of crazy, so maybe there'll be a train soon, right?
I think there's two things. One, the technology component's really important, but I think we can't underestimate the value of face-to-face interaction. And so I won't throw out that caveat without offering a solution, but maybe outreach in the community is another avenue. I think students are really eager to get their hands and their feet wet and get in there and provide care and be productive in that way and practice. And so there could be multiple benefits there, that you're educating as well as caring and providing a community service as well.
I appreciate your input and look forward to further conversation on the topic.
Yeah, thanks to the panel. I've got a comment, and and then a question. First of all, I'd like to pick up on your comment, Caren, about the language that we use. As you know, I'm a big believer in IPE, and often I find our language revolves around importance, enthusiasm, excitement, awareness. But at the end of the day, at institutions like this, the coin of the realm is evidence. You know, what is the evidence that there's a value here, not just whether I like it or not, whether I feel better. I'm really impressed with how the health science deans came together to put together this IPX initiative to try and fund, to try and generate some of the evidence of the value proposition of IPE. So my question for the panel is, has your preparation and your experience to date set you up to go after some of those IPX proposals? Do you feel like you've been enabled and are going to go after that to start generating some of the evidence that we so desperately need? Thank you.
Absolutely. We have till June. And really, I think we've been sent and worked with to a point where, okay, we're here with the students, so now what does that mean out in the community? What is the evidence? I mean, we already know that Meals on Wheels does have evidence. On the contrary to others' beliefs, there is evidence that Meals on Wheels is evidence-based. I won't say who, I'm contradicting. However, there's one big barrier, and that's legality. The legal realm of our education and our medicine and community work, there are legalities, and that's a real hard thing to have to work out, but that is one area that if we can truly, work on, it will make it truly easier. So we are going to go after the pilot grant, and then we're going to go after the bigger grant, and then we're going to go after Michigan Medicine to join with us. So, and maybe HRSA on the way. Might as well throw that in. Okay.
And I was going to contribute that I think that, as faculty, we all bring some skill to the table. And we may not be IPE experts, but through our collaboration with one another, as well as the use of the resources that are available on campus, I think we can pursue that line of funding as well as others. I think that, one of the reasons that I applied for the Fellows Program was to be able to do some of those kinds of things that lead to the evidence. Because our accreditation standards say we need to do this, but what's the evidence on the other end that says it improves outcomes for patients, it improves educational outcomes for our students, that kind of thing. And so whether we have those skills ourselves or whether it's through a collaboration with our colleagues, I think the answer is yes to your question.
Hi, my name is Jennifer. I'm currently a student in the School of Nursing. I've had the opportunity to be in one of Amber's clinical groups, so we're over at Ypsilanti Meals on Wheels working with their population. So since I've only gotten the nursing student perspective from it, I can see how beneficial it would be to have the interdisciplinary collaboration. But my question is, do you foresee being able to incorporate that into our curriculum, or is it just going to be kind of an elective opportunity that some people may not be able to take advantage of?
My goal is to have it, as we're writing the undergraduate curriculum, we're in the process of redoing, that thread is throughout so that those experiences will start, I'd like it to start at the freshman level, but at least have it threaded through so that each student is given the experience to be able to say, you know what, I want to work in the middle of with the health promotion. And then maybe even have some classes with public health, maybe have some classes with pharmacy. There's a good way to learn pharmacology, right? So the experiences, I just see it as in a classroom, multiple disciplines sitting in the same classroom. If we're all teaching the same thing, why don't we just kind of make a classroom for it?
Yeah, and based on the definition of interprofessional education that we're sort of focused on in the competencies, it's expanded a bit beyond the content of the information. And so what I'm wondering is if within your different schools and colleges and the curriculum you already have in existence, is there a way perhaps to go through and look and say these courses, these experiences meet IPE competencies, and then to be able to call that out to your learners so that they sort of recognize it's not just an elective, it's not a carve-out. Thoughts on that?
To some extent, pharmacy has already sort of jumped into that. We have a service learning course in our college, and several years ago it was opened up to students from other health professions. And I don't know that our colleagues have necessarily made it a required course in their curriculum, but certainly it's open to a number of other students. And in the last couple of years, we've had nursing students, kinesiology students, and others engaged in that course. So I think the answer is yeah, we need to do more of that.
And I think what you've already brought up about curriculum mapping, it can be very insightful about where there is opportunities for overlap, which inherently could create more efficiency as well in how students are taught. But I think that needs to happen from the very beginning, and I think it's easy to get ingrained in one philosophy of teaching and of care and forget about the others, and hard to introduce that collaborative component later on in an educational experience. So starting early in ways that can be overlapped for efficiency and for collaboration, I think is really important.
Sure, just briefly. So Jesse Burke-Raffel, I'm a fourth-year medical student here. I really appreciated the panel. It seems like, based on the plenary talk earlier, that one of the goals would actually be to change how providers think about interacting with each other, and that it's a behavior change that might be an outcome we might be hopeful to have. I wonder your thoughts on when that socialization happens, that we start dropping into our silos of the profession. And it strikes me that it might be harder to teach an old dog, new tricks. That starting at the pipeline level with even high school level students about and how our admissions teams go out and recruit people. The fact that our admissions groups go out individually and recruit people and say, are you interested in medicine? Well, here's the medicine folks, and here's the pharmacy folks, and I don't even know what kinesiology. But when we work with students in Detroit with Doctors of Tomorrow, it's Doctors of Tomorrow, but many of them are interested in STEM, and it crosses disciplines. So they haven't yet siloed themselves. And I wonder if focusing on these programs while wonderful fellow programs, might be an uphill battle, and that some of these resources can be diverted towards addressing kind of early pipeline.
No, I think that's a great point, and the professional identity formation is really important, and I think anyone who's applying, for example, to dental school already is thinking about what's important in dentistry and what's important in oral health, and maybe not putting that in the larger context of overall health. And if that's the message that we could send, overall health and well-being, I think that would be much more important.
Yeah, no, I think it's a great point, and I think there are multiple leverage points to sort of change the culture, right? So Dr. Ascioni talks about IPE culture here, and some of it is our input and who's coming in and how we can help guide that. So you're right, pipeline is important. I'm so thrilled that there are so many students here who are working together in this project. But then there's also the reality of, folks are already embedded in these sort of calcified systems, and so how do we help kind of shake that up a little bit? And so, it's a credit to the center for really looking at multiple facets and approaching it on a variety of levels. And so, to that end, I want to just thank everyone really for being here and for engaging. When we sort of started this project and thought,
while you thank people, now I'm the architect of this program, but I want to point out something about the Michigan culture. That's why this is so impressive. I came up with the idea because I was at a trainer program, and I thought, geez, this would be a great idea to do this. I had no idea how to do it. But I knew enough about CLT that I went to them and said, here's my vision of what we're going to do. Tell me what we have to do. And your folks, and Gina wasn't there were other folks that are there, that's still here, came up with the idea. Then the next step was, well, are people going to be embracing it? So we recruited faculty and put you all together, and you created these ideas. And to me, the Michigan culture, first of all, there are existing institutions like CRLT who know how to do these things and are the innovators of doing it, and then the faculty. And so part of why we have been successful is because of who we are as a university and a diversity of it. And I think we can applaud all of ourselves, and I think this is a reflection here, and Caren and so forth. And it's not as impossible as it sounds because of the energy here to do that. And as I listen to all the folks here, it really reinforces the fact that we really have that traditional momentum to do that, including with Caren and her group. And I wanted to, since you're not going to thank yourself, I will thank Caren and the folks here at organizing this group here. And I want to give them applause for what they've done. Now you can talk.
Now I can't talk. I'm going to turn red. Thank you. Because the truth of the matter, right, is if you had said, oh, let's get all the health science schools to come together and share their work on education, there might have been a few people who, when I floated that idea, said, you're going to do what? But again, it's a testimony to our culture, right? To our trust in one another, to our ability to work together, and to engage all units on campus, right? Academic innovation, CRLT, all of the health science schools, both here and in Dearborn and in Flint. And so I'm really looking forward to, getting to know more of you, to getting us to work all together, to looking at posters and work and seeing how that work gets translated. I'm serendipitously, the National Academies of Practice has actually called April IPE month. And so moving forward, I hope that we can continue this gathering together of our scholarship and community in Aprils. So stay tuned for future work and future information. As always, if people show up, you really should feed them. And so I'm happy to report that there are boxed lunches on the way out. A couple of just housekeeping things. Recall that there's those yellow sheets of paper that are your evaluation forms. We really, really appreciate it because we look at them and we make changes to the program based on your feedback. If you could get your stuff into Deep Blue, that would be wonderful. And if you want to connect with any of your colleagues and the posters that you've seen, just put your card or some information in the envelopes. So I want to thank our panel members today. I particularly want to thank Dr. Miladovich for being here with us and to everyone. So have a great day, you guys. Take care.